We begin with developing news. President Donald Trump announced today, that the U.S. Food and Drug Administration will be notifying physicians that the use of acetaminophen during pregnancy can be associated with a very increased risk of autism. Thanks for joining us for Western Mass News at 6 on this Monday. I'm Chris Pisano.
And I'm Amanda Martin Ryan. Western Mass News reporter Madison Lazowski joins us live in the studio with the latest from that announcement. Madison.
Yeah, Amanda and Chris, the president claimed that women should not use it during pregnancy unless medically necessary, such as a fever, linking the use of Tylenol during pregnancy to autism. About 1 in every 31 children was diagnosed with autism by age 8 in 2022. That's up from 1 in 36 in 2020. Now, several studies have looked at the association between acetaminophen use in pregnancy and the development of autism in children. But experts say the science behind this theory is not settled. According to Tylenol website, they are already debunking the president and the Health and Human Services Secretary's claim. Their statement reads in part, "We understand the recent media coverage you're reading may cause concern or lead to questions. We want to make sure you have the answers. Here's what we can tell you. Credible, independent scientific data continues to show no proven link between taking acetaminophen and autism. Medical and public health organizations agree." The president claims that this discovery is the answer to the developmental disorder.
That's one of the things that I'm very, very happy about. I mean, this was mostly going to be on how not to have the child affected, but we've learned some pretty good things about certain elements of genius that can be given to a baby, and the baby can get better. And in some cases, maybe substantially better.
Newmer, the medical director for the Lurie Center for Autism at Mass General Brigham for Children, wrote in a statement, quote, "By studying genetics, brain development, early life experiences, and biological and environmental factors, we aim to identify autism earlier, tailor treatments, and better support individuals and families. Through this approach and with current validated evidence from large clinical trials, there is no established proof that acetaminophen is a cause of autism." Now, for more information on this afternoon's announcement or more details on autism research up to this point, you can head to our website at westernmassnews.com. For now, reporting live in studio, Madison Lasowski, Western Mass News.